Here's my workspace. I'm going to show you guys my area. Okay, this is me in uniform, hair up. I have my no jewelry, my scrubs and my underscrub, and then my shoes on and my ID. I'm gonna put you guys up here so that you can see everything. I'm gonna show you guys my student ID. My name is Asia Bowie. Okay, and so to start medication administration, I'm going to plan my medication administration to make sure I have no interruptions. This means I'm going to close my medication room door. I'm going to make sure to take no phone calls. I'm going to limit my conversation with colleagues to only essential information, and then I'm also going to make sure to follow the agency's no interruption zone policy. And to start, I'm going to go ahead and pick up my order form and compare that to the medication administration record, which is the MAR. And so I have my patient today, Mr. Jaguar J. Jones, and on here it says Jaguar J. Jones. His date of birth is 8/25/1963, and his date of birth is 8/25/1963. His MR number is 4176352, and on here it says his MR number is 4176352. It says here that Mr. Jones is allergic to penicillin, and on the MR it also says he's allergic to penicillin. The medication that we're going to be giving him today is heparin, and on here it says that the medication we'll give is heparin. It says here that the dosage will be 5,000 units, and on here the dose is 5,000 units. I'll be giving him it subcutaneously, and on here it says subcutaneously. Right here it says every 12 hours, and right here it says every 12 hours. And we're going to be giving his heparin today as an anticoagulant to make sure that his blood isn't clotting. And then, yeah, so now I'm going to put this patient care order form to the side and look at the medication administration record. I'm going to perform hand hygiene. And looking at the medication administration record, I'm going to look at my patient again. And so my patient is Mr. Jaguar J. Jones, and he's going to be having heparin today. So I'm going to go ahead and look for that heparin. Found the heparin. I'm going to take that vial and compare it to the medication administration record. So heparin and heparin. Okay. It says here that we're going to need 10,000 units for his 1 milliliter, but on the medication administration record, it says we need 5,000 units. So to get to 5,000 units, it's 10,000 units for 1 milliliter. That means we need half a milliliter. Okay. And it says here that the expiration date is 12/5/2028, so it's not expired. I'll go ahead and show you guys the heparin. Okay. It says that we're going to be giving this subcutaneously, so I'm going to select the tuberculin or TB syringe and needle. Here's my syringe and needle. Okay. So I'm going to double check again. We needed heparin, we have heparin. It says we need 5,000 units. So 10,000 units for 1 milliliter, that means I'm going to need half a milliliter. And subcutaneously means we'll use our TB syringe. So I'm going to go ahead and open my vial and take an alcohol prep pad and clean my vial. And we're going to open our syringe. And we're going to pull back half a milliliter of air to match our dosage. We're going to pull up half a milliliter of air. The medication. And making sure not to pull up any air bubbles. Okay. I'm going to take that out, and I'm going to go ahead and put the safety up. And I'm going to compare this, make sure my medication and the dosage is right. So heparin and heparin, 5,000 units. So heparin, it says 10,000 units for 1 milliliter. That means I needed half a milliliter. And I would check with another nurse as indicated, and I would make sure to verify my dosage amount. So I'm going to show you guys this half a milliliter in my syringe. It says we're going to give it every 12 hours. The last time it was given was 12 hours ago, and we're going to be giving this as an anticoagulant. So all elements of a legal prescription are included. So now I'm going to make a label with the patient's name, with his medication name, and the dose. So my patient is Mr. Jaguar J. Jones. His medicine is heparin. We have heparin. And the dose was 10,000 units for 1 milliliter, and we needed 5,000 units. So 5,000 units would be half a milliliter, and we have half a milliliter in the syringe. Okay, I'm going to put this on the syringe, making sure not to cover the mark so that I can monitor how much is in the syringe. Okay, we're going to take the syringe and vial again and check with the medication administration record. So our patient, Mr. Jaguar J. Jones, is going to be getting heparin. We have heparin, 5,000 units. So we have 10,000 units for 1 milliliter. So to get 5,000 units, we needed half a milliliter, and I have half a milliliter in my syringe. We're giving it subcutaneously, so we have a tuberculin syringe and needle every 12 hours. The last time it was given was 12 hours ago. And we're going to be using this as an anticoagulant. Make sure that his blood isn't clotting. And so all elements of a legal prescription are included. Now I'm going to take this medication administration record, the vial, and my labeled syringe and needle, and we're going to go to the patient's room. Okay, now that I'm in the patient's room, I'm going to perform hand hygiene again. And I'm going to take the medication administration record, and I'm going to check the patient's armband. Hi, Mr. Jaguar J. Jones. I'm looking at your armband and my medication administration record. Jaguar J. Jones. Jaguar J. Jones. His date of birth is 8/25/1963. Date of birth 8/25/1963. Medical record number 4176352. Medical record number 4176352. Right here it says he's allergic to penicillin, and on his allergy band it says he's allergic to penicillin. So Mr. Jones, do you have any other allergies that I should be worried about or that you want to talk about today? No? Okay, that's good then. Okay. So I'm going to raise his bed and lower his side rail. Now I'm going to explain the procedure. So Mr. Jones, today I'm going to be administering some medicine for you. You're going to be getting heparin today, and that's an anticoagulant to make sure that your blood doesn't clot. And I'm going to perform any assessments that would indicate. So I would perform and make sure that his heart rate is good and his blood pressure is good. And then also I would check for any bruising. Okay? Now I'm going to go ahead and take the medication and the syringe that's labeled with the needle on it. And I'm going to compare that to the medication record. So we have Mr. Jaguar J. Jones. his medicine today is heparin. We have our heparin medicine. And then 5,000 units. To get 5,000 units, we did 10,000 units for 1 milliliter. So to 5,000, it's half a milliliter. I have half a milliliter in my syringe. We're giving it subcutaneously. So I have my tuberculin syringe and needle every 12 hours. So last time it was given was 12 hours ago, so I can give it now. And we're using it as an anticoagulant today. And so all elements of legal prescription are included. Okay. So now I'm going to put on my gloves. So Mr. Jones, today I'm going to be giving this as a subcutaneous injection. And so that means I'm going to be doing it on your abdominal region. So that means I'm going to be doing it below your costal region and above your pubic region and in between your anterior superior iliac spine. And it's also going to have a 2-inch border around your umbilicus or your belly button. Okay, so now I'm going to look at his skin and make sure there's no bruising or lesions that should be, or anything abnormal that I should be worried about. And I'm going to grab an alcohol prep pad and I'm going to clean the area. And I'm going to draw back the safety. I'm going to pinch the skin, and I can administer this 90 degrees or 45 degrees depending on how much sub-Q tissue he has. So I'm going to do 45 degrees today because I can only pinch up 1 inch. So I'm going to do it quickly. Insert, and I'm going to insert it slowly. Okay, I'm going to take it out and then flip up the safety, throw it in my sharps container. Then I'm going to dab the area and make sure not to massage. Okay, and then I'm going to lower his bed and raise his side rail. I'm going to do glove to glove, skin to skin, and throw that in the trash. And then I'm going to assess for any allergies and any allergic reactions happening to that area. And I don't see any. So now I'm going to document how the procedure went and how Mr. Jones took the procedure, if there was any reactions, and if there's any allergic reactions. And now I'm going to leave and come back in another 30 minutes to make sure no additional allergic reactions were happening. That is my medication administration for heparin.